Welcome. Today, we're diving into the world of mammograms, a crucial tool in women's health. If you've ever wondered what a mammogram actually measures and what those results really mean, you're in the right place. We'll break down the basics, explain the process, and help you understand how to interpret the findings. Let's start by exploring what a mammogram is and why it's so important for early detection of breast issues. A mammogram is a specialized X-ray of the breast, designed to detect changes in breast tissue. It's a non-invasive procedure that can spot tumors or abnormalities long before they can be felt. Mammograms are a key part of routine breast cancer screening, especially for women over 40 or those at higher risk. The process is quick and usually takes about 20 minutes. Let's look at what exactly is being measured during this test. During a mammogram, the breast is gently compressed between two plates to spread the tissue. This allows for clearer images and helps radiologists spot even tiny abnormalities. The X-ray images are then captured from different angles, providing a detailed look at the internal structure of the breast. This process is safe, with minimal radiation exposure, and is designed to maximize accuracy while keeping you comfortable. A mammogram measures the density and structure of breast tissue. It identifies areas that look different from normal tissue, such as masses, lumps, or calcifications. These differences can indicate benign conditions, like cysts, or more serious issues, such as tumors. The test is sensitive enough to detect changes that are too small to be felt, making it a powerful tool for early intervention. There are two main types of mammograms: screening and diagnostic. Screening mammograms are routine checks for women without symptoms, while diagnostic mammograms are used when there's a specific concern, like a lump or unusual pain. Diagnostic mammograms take more images and focus on the area of concern. Both types use the same technology, but serve different purposes in breast health management. Breast density is an important factor measured by mammograms. Dense breasts have more glandular and connective tissue than fatty tissue, which can make it harder to spot abnormalities. Women with dense breasts may need additional imaging tests for a clearer picture. Knowing your breast density helps tailor your screening plan and ensures nothing is missed during routine checks. Calcifications are tiny deposits of calcium in the breast tissue, often detected by mammograms. Most calcifications are benign and caused by aging, previous injuries, or inflammation. However, certain patterns of calcifications can be a sign of early breast cancer. Radiologists look at their size, shape, and distribution to determine if further testing is needed. Mammograms are excellent at detecting masses or lumps in the breast. These can be solid or fluid-filled and vary in size and shape. Not all lumps are cancerous. Many are benign cysts or fibroadenomas. The appearance of a mass on a mammogram helps doctors decide if more tests, like an ultrasound or biopsy, are needed for a definitive diagnosis. Microcalcifications are very small calcium deposits that appear as tiny white spots on a mammogram. While most are harmless, certain patterns, like tight clusters, can be an early sign of cancer. Radiologists carefully analyze these patterns to decide if a biopsy or closer monitoring is necessary. Understanding microcalcifications helps in catching potential problems early. Macrocalcifications are larger calcium deposits, often seen in women over 50. These are usually caused by aging or benign conditions and rarely indicate cancer. On a mammogram, they appear as larger, scattered white spots. Radiologists typically don't recommend further testing for macrocalcifications unless there are other suspicious findings. After your mammogram, a radiologist reviews the images and prepares a report. The results are usually categorized using the BI-RADS system, which helps standardize findings and recommendations. This system ranges from 0 incomplete to 6 known cancer, guiding what steps should be taken next. Understanding your BI-RADS category is key to knowing what your results mean. The BI-RADS system classifies mammogram results into categories from 0 to 6. Category 0 means more images are needed, 1 is negative, 2 is benign, 3 is probably benign, 4 is suspicious, 5 is highly suggestive of malignancy, and 6 is a known cancer. Each category comes with specific recommendations for follow-up or treatment, making it easier for patients and doctors to plan next steps. A BI-RADS Category 0 means the mammogram is incomplete, and more images or previous records are needed for a clear diagnosis. This isn't a cause for alarm, it simply means the radiologist needs more information to make an accurate assessment. You may be asked to return for additional views or provide past mammograms for comparison. A BI-RADS Category 1 result means your mammogram is negative, no signs of cancer or suspicious changes were found. This is the best possible outcome and means you should continue with routine screenings as recommended by your doctor. It's a sign that everything looks normal at this time. A BI-RADS Category 2 result means the findings are benign, non-cancerous. This could include cysts, fibroadenomas, or other harmless changes in the breast tissue. No additional testing is needed, and you can continue with your regular screening schedule. It's reassuring to know that not all findings are cause for concern. A BI-RADS Category 3 means the findings are probably benign, with a very low chance of cancer. Your doctor may recommend a short-term follow-up mammogram in 6 months to ensure nothing changes. This approach helps catch any issues early while avoiding unnecessary procedures. A BI-RADS Category 4 result is considered suspicious, meaning there's a moderate chance of cancer. Your doctor will likely recommend a biopsy to determine if the abnormality is cancerous. While this can be concerning, remember that not all suspicious findings turn out to be cancer. A BI-RADS Category 5 means the findings are highly suggestive of cancer. Immediate action is needed, and a biopsy will be performed to confirm the diagnosis. While this category is serious, early detection greatly improves treatment outcomes. Your healthcare team will guide you through the next steps. A BI-RADS Category 6 is used when cancer has already been diagnosed, usually through a previous biopsy. This category helps track the progress of treatment and monitor for any changes. It's important for ongoing management and ensuring the best possible outcome for the patient. Sometimes, mammograms can show an abnormality that turns out not to be cancer. These are called false positives. While they can cause anxiety and lead to extra tests, they're a normal part of screening. The goal is to catch any potential cancer early, even if it means some extra follow-up for benign findings. A false negative occurs when a mammogram misses a cancer that is actually present. This can happen if the tumor is very small or hidden by dense tissue. While mammograms are highly effective, no test is perfect. That's why it's important to report any new breast changes to your doctor, even after a normal mammogram. While mammograms are a powerful tool, they have limitations. Dense breast tissue can make it harder to spot abnormalities, and not all cancers show up on mammograms. Additional tests like ultrasound or MRI may be needed for a complete picture. Understanding these limitations helps set realistic expectations and encourages proactive health management. Most guidelines recommend starting routine mammogram screening at age 40, but this can vary based on personal risk factors. Women with a family history of breast cancer or other risk factors may need to start earlier. It's important to discuss your individual risk and screening plan with your healthcare provider. The frequency of mammograms depends on your age and risk profile. Most women are advised to have a mammogram every 1 to 2 years. Those with higher risk may need more frequent screening. Regular mammograms increase the chances of catching cancer early when it's most treatable. To prepare for a mammogram, avoid using deodorants, lotions, or powders on the day of your exam, as these can appear on the X-ray. Wear a 2-piece outfit for convenience, and bring any previous mammogram images if you have them. Being prepared helps ensure the best possible images and a smooth experience. During the mammogram, you'll stand in front of the machine while a technologist positions your breast on the plate. The breast is gently compressed for a few seconds to get clear images. You may feel some pressure, but it shouldn't be painful. The process is quick, and you'll be guided through each step for comfort and accuracy. Once the mammogram is complete, you can resume normal activities right away. The images are reviewed by a radiologist, and results are usually sent to your doctor within a few days. If anything unusual is found, you'll be contacted for follow-up tests or additional imaging. Most results are normal, so try not to worry while waiting. You'll receive your mammogram results from your healthcare provider, usually within a week. The report will explain the findings and any recommendations for follow-up. If you have questions, don't hesitate to ask your doctor for clarification. Understanding your results empowers you to make informed decisions about your health. If your mammogram shows something unusual, your doctor may recommend more tests, such as additional mammogram views, ultrasound, or a biopsy. These follow-up tests help clarify the findings and determine if any treatment is needed. Most follow-ups do not result in a cancer diagnosis, but they are important for your peace of mind. Breast ultrasound is often used as a follow-up to mammograms, especially for women with dense breasts or unclear results. Ultrasound uses sound waves to create images and can distinguish between solid masses and fluid-filled cysts. It's a painless, non-invasive test that provides valuable additional information. Magnetic resonance imaging, MRI, may be recommended for women at high risk or when mammogram results are unclear. MRI uses magnets and radio waves to create detailed images of the breast. It's especially useful for detecting cancers that are hard to see on mammograms, but it's not used for routine screening in most women. A biopsy involves removing a small sample of breast tissue for laboratory analysis. This test is recommended if a mammogram or other imaging shows a suspicious area. There are several types of biopsies, including needle and surgical, and your doctor will choose the best one based on your situation. Biopsies provide a definitive diagnosis. Waiting for mammogram results or being called back for more tests can be stressful. It's normal to feel anxious, but remember that most findings are not cancer. Support from friends, family, and healthcare providers can help you cope with the uncertainty. Taking care of your emotional well-being is just as important as your physical health. It's important to have an open conversation with your doctor about your mammogram results. Ask questions about anything you don't understand, and discuss your risk factors and next steps. Your doctor is there to guide you and help you make informed decisions about your breast health. Your personal risk factors, such as age, family history, and genetics, play a big role in your breast cancer risk. Discuss these with your doctor to determine the best screening plan for you. Some women may need earlier or more frequent mammograms based on their individual risk profile. For women with a strong family history of breast cancer, genetic testing may be recommended. Tests for BRCA1 and BRCA2 gene mutations can help assess your risk and guide screening and prevention strategies. Talk to your doctor about whether genetic testing is right for you. Healthy lifestyle choices can reduce your risk of breast cancer. Maintaining a healthy weight, staying active, limiting alcohol, and not smoking all contribute to breast health. Regular screenings combined with healthy habits offer the best protection against breast cancer. In addition to mammograms, being aware of changes in your breasts is important. Regular self-exams help you notice lumps, changes in shape, or other unusual signs. If you detect something new, contact your doctor promptly. Self-awareness complements routine screening for the best breast health. There are many myths about mammograms, such as the idea that they're always painful or that radiation is dangerous. In reality, most women find the discomfort minimal, and the radiation exposure is very low. Mammograms are safe, effective, and essential for early detection. Digital mammograms store images electronically, making them easier to share and analyze. Traditional film mammograms use X-ray film. Both are effective, but digital technology offers clearer images, especially for women under 50 or with dense breasts. Ask your provider which type is available and best for you. 3D mammography, or tomosynthesis, creates a three-dimensional image of the breast by taking multiple X-rays from different angles. This advanced technology improves detection rates and reduces false positives, especially in women with dense breasts. It's becoming more widely available and may be recommended for some women. Most health insurance plans cover routine mammograms, especially for women over 40. Some programs offer free or low-cost mammograms for those without insurance. Check with your provider or local health department to understand your options and ensure you stay up to date with screenings. Screening guidelines can vary by country and organization. Some recommend starting at age 40, others at 50, and the frequency may differ. It's important to follow the guidelines that apply to your region and discuss any concerns with your healthcare provider. Mammograms are a vital tool for early detection of breast cancer. They measure breast tissue density, spot abnormalities, and help guide further testing if needed. Understanding your results, knowing your risk factors, and staying up to date with screenings are the best ways to protect your breast health. Remember, knowledge is power when it comes to your well-being. Thank you for joining us on this journey to understand mammograms and their results. Regular screening, awareness of your own body, and open communication with your healthcare team are your best defenses against breast cancer. Stay proactive, stay informed, and take charge of your breast health.